cleanliness that has you know, a much broader spectrum than just our own website to ensure that everybody is up to speed, you know, once we flip the switch and go live.
Yes.
I have a question regarding the eligibility. You had said if a person applied for it early in the month, and they would, you know, early in January, they'd get it by February 1st. And I'm wondering how that, currently in the Medicaid system, when patients enroll and they give you their eligibility financial information, it's taken months right now for DSS to even verify that income. How does the exchange think they're going to do it in two weeks? Because you said that they puts their eligibility information in the computer, and it tells you right along. But who's to say they're giving you correct information? So I'm assuming you're verifying that eligibility. So that's
does.
one question. Oh, I'm sorry.
Okay. I was just going to say, in terms of the eligibility verification, that's really what we're facilitating through that hub. So that hub, it pings about 11 different systems in order to make sure that we are getting all the proper verification electronically, whereas there were likely manual processes which took place before. So that should cut down on that process time in a fairly large way.
And my second question is for behavior. I'm sorry.
What income are they putting in that you're verifying against?
What's that?
If you're saying that they're putting in, if they're putting in income information, and she's questioning, you know, how quickly you can verify that. You're saying that they're paying against the system. Is the income information that I'm required to put in my adjusted gross income from my last tax return? So then they're paying against the IRS, or how are you verifying income?
There is IRS information which needs to be verified. As it relates to Medicaid, currently there are current income questions, not necessarily based on prior year's tax return, but current information. For certain pieces of the Medicaid eligibility process, there could be one, self-attestation, or two, if there's not the ability to do that, there may be the need to actually send in some sort of physical verification to a fax number or some other location. For the most part, the majority of the elements are electronically verified, but there are a couple, and I'm not going to be able to tell you what they are off the top of my head, that may still need some level of attestation that could be a paper copy for a particular scenario.
It'd be nice for the state of Medicaid, DSS to put a system in place too, so it doesn't take 3 months to, you know, approve. I know they're so far behind on applications right now. My second question was for the patients that, for behavioral health, currently these larger insurance companies are subcontracting out managed care companies. So what happens with those? Are we expecting, if we provide behavioral health services, to be looking for addendums to the contracts for the behavioral health companies as well?
I don't know the answer to that. In terms of, you know, how carriers contract or subcontract handling behavioral health, it's again between the carrier and the actual providers. The exchange doesn't have any influence there.
Yes.
Is it CMS or the carrier that has authority, regulatory authority over the health insurance exchange pages?
So from a regulatory perspective, the exchange is a quasi-public state agency here in Connecticut. We do have a board of directors which oversees all of our activity. And so at this point, you know, we are beholden to the state, not necessarily at the federal level, given the fact that we are now moving forward with a state-based exchange.
Any other questions? No? Yes, one more.
We have them sign a waiver from a physician's practice point of view because of the federal funding issue that we have with Medicaid. We can't collect money from